Carol Day, and I'm here because I've been working in video relay service for the last 6 years, and our benefits have been cut repeatedly. And this particular strike today is about healthcare and safety, workplace safety. They continue to raise the requirement for how long we have to sit in our stations and process calls. And at this point, it's about 50 minutes every hour. And it's starting to wear on people's bodies, and it also affects the accuracy of our interpreting. The research shows that 20 minutes is about max in terms of accuracy, and we're supposed to be on the phones 50 minutes out of an hour.
So it's affecting the clients as well.
It's affecting our clients a lot, because if we're fatigued or if we're injured, we can't do the best job that we could do. I don't think we've had OSHA complaints, but we have brought that up in our negotiations with the contract. I think a lot of us are tired for sure, and I think that the potential to be hurt is there.
So the healthcare benefits, what have they done to threaten your conditions?
Apparently, well, I don't get healthcare because I'm not full-time anymore, but the full-timers do, and apparently they are upping their contribution portion and also upping their contribution towards their dependents without having negotiated with the union about it.
Isn't that illegal?
I think so. Yeah, well, there are, I can't remember what they're called, ULPs? Yeah, they've been, there's a few right now in place with them, so yeah, they don't seem to change once that happens.
Have you been in a union before?
I have. I was in a teachers union for 8 years, and a union at Kaiser for social workers.
So you do sign language. How did you learn sign language?
I just took a class. I've been interpreting since 1979. So I took a class and just loved it, and then it just became what I did. And it's my passion, I guess.
Yes.
Okay.
I'm Karen, and I'm a fairly recent employee of Purple, and I knew that I was coming in to a company and a service center that was going to be unionized, and I was really excited about that. And I'm here to support my local, my fellow coworkers in our struggle for fair health care and also fair work practices. So I became a sign language interpreter because I fell in love with the language, and I decided to keep going because it's a niche, it's a little niche in our society that we serve a great need, and so it's rewarding. So it's unfortunate we have to be out here and fight for something that's a very basic right, human right, basic human right, yeah, for healthcare. And we're a small niche of interpreters, and we deserve,
How did you learn interpreting? How did you get that skill?
I just took it in college and fell in love with it, and then I pursued deaf studies, so I have a degree in deaf studies.
So you're a professional interpreter?
Correct, and I'm a nationally certified interpreter as well.
Right. And so why don't you say this in sign language about what your interests are? Can you do that? Just to let people know in sign language your story? Can you do that? No.
I'm really shy. We have to kind of, we have to look for different types of employment. So a lot of us don't only work here. We also work in the medical field, where we're experiencing the same thing, where big hospitals are starting to move away from the live translator and replace us with machines, and they don't realize that sign language is a little bit different. We're a human service. Quality of the interpreters and quality of service is not something that you should compromise. It's definitely different from interpreting out in the field. When we're out in the community, most assignments are only, less than an hour, and even after that hour, mentally, studies have proven that mentally you become fatigued, and that compromises the quality of our work.
So the actual clients they're threatened by this extended hour?
Oh, definitely. It will compromise their communication and the situation, and the quality of communication will suffer as well.
I am an labor practice over healthcare. We are currently in bargaining and have been in bargaining with the executive level of Purple over healthcare. Thank you! Woo! And we're in negotiations right now, and they're refusing to negotiate our healthcare. They unilaterally imposed an increase on our healthcare that we are paying and an increase in our percentage that we are paying. That's the reason that we're striking today. We organized for other reasons over a year ago. We filed with the National Labor Relations Board to unionize over many unfair practices like pay cuts. I took a 33% pay cut, and one day I was informed that at noon my pay would be cut by 33%, and if I didn't like it, there was the door. We had a lot of other benefits cut. They've also sped up our work. We're working at a 13% higher productivity level than we did 2 years ago. All of the cuts that they're making, they're requiring us to work more, and if we don't meet the standards, we get written up, and people are getting injured. We have colleagues who are out on workman's comp injuries, and they're essentially trying to take our profession away from us. If I get injured, I cannot do this work, and I cannot serve the deaf community to provide access for them.
And the injuries, what are they a result of? I mean, this introduction of this video monitoring or video systems.
We are processing phone calls via video for the deaf and hard of hearing community. The company that we work for is a private company that gets reimbursed for every minute that we're interpreting phone calls over video, and they are requiring us to interpret more and more minutes per hour. So the injuries that are happening are overuse injury, carpal tunnel injuries, and workers are not able to do the sign language work that they are supposed to be doing if their hands are hurting.
And is this introduction of video monitoring threatening the professionalism of interpretation?
It's not actually video monitoring. We work over video. So when we have a person call through our service, they can see an interpreter on their screen, and the deaf user can see the interpreter, and we can make phone calls for them. So we're an accommodation for the telecommunication service that hearing people enjoy, which is a regular telephone. A deaf person has to use our service in order to make a telephone call. By forcing us to work more, they can get more billable minutes out of us. We get reimbursed per minute, and the more minutes they can get out of us, the more profit they can squeeze. It is about profit. Today, it's about unfair labor practices. We filed many unfair labor practices against the company. Today, it's over their unilateral imposition of health care. But it's increase in the amount that we are paying for health care and an increase in the proportion that we are having to pay without negotiating with us. Essentially, when you're paying more out of your benefits, for your benefits, and you're not getting a raise, it is essentially a pay cut. But this is not about money. We're not asking for a pay raise. We're asking for the company to have healthy and safe work level expectations so that we cannot get injured. I've been interpreting for 24 years. I've worked for Purple 9.5.
Patrick, there's very few of them. We're sign language interpreters. There's very few movements that you can do. So we're very prone to carpal tunnel syndrome. When you do a phone call for an hour, there's encouragement to continue going. They do allow for breaks. If you were to hold your arms out and just squeeze like this for an hour, you can see what we can do in 8 hours. A lot of repetition motion. So therefore our health care, if we have to go for carpal tunnel surgery, is kind of important to us.
And is there a problem with carpal tunnels?
Yes, it's rampant in our industry. It used to be that we would work 20 minutes on, 20 minutes off because of that. People take 10 to 15 years to get certified, and once they get certified, they can work in a community, legal settings, doctor's office, that kind of thing. Well, we're concerned that we're going to lose the ability to continue to make a living, because once you have the surgery, you're basically done.
So in other words, your career is ruined as a result of carpal tunnel syndrome.
Yeah.
And what does the company say about it? I mean, you're losing interpreters.
Well, Ohlone College is one of 10 centers in the country. They produce 8 interpreters. There's 22 community colleges in the Bay Area. They have deaf students at many of them. If you're only producing 8 interpreters every 2 years, they're going to run out real quick.
Well, as far as ergonomics, I mean, aren't there standards to protect
Sitting position, yeah, but not the number of hand motions you do. They want us logged in a certain number of minutes per hour, and that rate went up last year. That's why they founded the union in the first place, is they increased the number of minutes. It's not like we want to sit back and not do anything. Actually, the physical building up of the salts in your hands. Okay, literally, if I was to sit here and do this for 5 minutes, anybody that's on the street could do the same thing for 5 minutes. You can imagine what an hour would feel like. Then imagine what 8 hours feels like. We get an average of 6 to 9 minutes an hour to put your hands down. Phone calls come in 3 to 6 seconds apart. It doesn't